I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Hi, and welcome back to The Gritty Nurse, an unfiltered conversation about healthcare, nursing, and the intersection of health politics and policy. My name is Amy, and I am The Gritty Nurse. This podcast examines hot topics in healthcare and discusses the changes that we need to see to have a more efficient, robust, and ethical healthcare system that is safe not only for the patients that we see, but also for those who work in the system as well. Sorry, no fluff here, just awesome, compassionate humans and a lot of grit. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit that subscribe button so you never miss out on any real stuff from The Gritty Nurse. As a nurse, I've had my own challenges when it comes to talking about allergies. What is the difference between an allergy and a sensitivity? Am I really allergic to cow's milk? What about the whole conversation in relation to Benadryl? What if your child has an allergy in the home and you have other children? Should you introduce them to that allergen? Do I really need to carry that EpiPen? Well, I have someone here that can answer all those questions. Today, our guest is a physician who's a powerhouse in clinical immunology, as well as an allergist, and is currently the president of the Ontario Medical Association. Today, we are joined by Dr. Zainab Abdurrahman. As the president of the Ontario Medical Association, she's taking on some of the biggest challenges in our healthcare system, from vaccine equity to inclusive leadership. She's also a clinical professor, specialist in immunology, and a fierce believer in systemic change. From her work on the Black Scientists Task Force to her roles at McMaster and TMU, she's combining high-level biostatistics with a deep personal commitment to health equity. Please welcome this leader who isn't just looking at the data, but looking out for people behind it. Welcome, Dr. Zainab Abdurrahman. Welcome to the show, Zainab. Thank you so much for coming on. Your expertise is needed in this area, let me tell you, because I've had my own instances of having children with pediatric allergies and being a mom and a healthcare provider, but also just being like, what am I doing? I think a lot of guests will be really happy to hear from you. But before we get started, could you tell us a little bit about yourself and how you came into medicine and why did you choose being a pediatric allergist and a clinical immunologist?
Thank you. Well, thank you for having me. My journey through medicine, I think had a lot of twists and turns in the way. I was lucky. My dad is now a retired pediatrician, so I did have some of the insights into medicine, and I knew I loved science and I liked people, so it was a natural combination. And I used to work in his office in some of my summers in high school. And I really loved also like babies and children. So I knew I liked that. And then when I actually got into medical school, I did actually consider other realms as well. I considered some surgical specialties. I considered adult medicine. But in the end, I think life and you get steered into the right direction, I think. So, you have these moments, but then in the end, I really wanted to do pediatrics. And I'd had some exposure to allergy immunology in medical school, but then it was actually as I was going through my electives in medical school where I actually got to see some pediatric allergy and immunology more in practice, more than just theory, and I really liked the group.
Right.
And then when I got into residency, then I started looking at it, and then it's actually interesting because we actually have the option to also see adults again, which I had thought, oh, I've retired that hat. I won't see any more adults, because you do miss that. It's interesting to kind of really concentrate, but then it's actually the ability now. So when I see my young patients, I know they don't have to go somewhere else. If they need to see me again later when they're grown up, they can just come back and see their same allergist. So I really like
cool.
that.
Yeah, no, I think that's actually really cool because one of the things that I noticed, and maybe it's changed a little bit, my child had an allergist and getting into seeing him is virtually impossible. And we take the trek, we'll make the long trek from Hamilton to Etobicoke, but it's really hard. And I don't know, maybe I should find that out. I don't know if he will follow him into adulthood. So maybe that's something I need to kind of check into.
Yeah, so we have the ability. Some people focus still like on more adult or more pediatric because you can go through either pediatrics or internal medicine. Some people feel more comfortable with one or more of the kind of populations. I like to see my patients. I like to continue with them. So I tend to still see people in adulthood as well, although I would say my practice is primarily pediatric. But in terms of your search, you're not wrong. There are not that many allergists in Canada. There's probably about 250, maybe 300 if we're really pushing it
Yeah.
across the country. And then
Wow.
Ontario has about 150, maybe a little bit more as we have new graduates. So that part is harder because if someone has anaphylaxis, they can be in my office within, 7 days. And I said, well, upstate New York has think more than 300 allergists. And
Right.
we as an entire country did not even have that many.
Yeah.
So some of those issues were also interesting because a lot of the American allergists were very confused as to why there were so few of us in Canada.
Sure.
So
That's like a whole other conversation, right?
yeah,
Like I think that again speaks to I mean their population is way more than Canada's. Like I think
yes,
we fit inside of California. So
yes.
I mean we should see that there should be that much more. But then again, I think that speaks to the fact that maybe more physicians need to go into that it's a subspecialty, right?
It's a subspecialty.
Yeah.
So you have to either go into pediatrics or internal medicine first. And then afterwards, you pick that as a subspecialty. And that's actually one of the things that as a specialty, we were really focused on in terms of our national association is bringing residents in to come to our conferences to see and hear about us because we are small. So
Right.
you may not get as much exposure as maybe cardiology or respirology, things that you're going to see all the time. But it's really common. I mean, have you ever met someone who is not familiar with allergies or knows someone,
It is. I don't know anybody who doesn't have allergies, to be honest, right? Like I think you're right. There's probably nobody I know that does not have allergies. And I guess it begs the question,
or
right?
is not linked to someone who has an allergy. Everyone is familiar with it. So I think raising that and bringing more people into it has been a focus for us. And I think it's been panning out because we're seeing more and more allergists graduate now.
No, that's really amazing. And I think again, it's something that's really needed because one of the things that I find I hear a lot from, like my friends or colleagues, they'll sneeze or they'll have a sniffle or, they go into a room, they're like, ugh, and they're like, I'm like, do you have a cold or whatever? Well, no, it's allergies. I'm like, have you ever checked that out? They're like, no, we just know it's allergies. I'm like, really? Like maybe you should look into what your allergy might be. But I want to back it up a little bit. So I asked you to tell me a little bit about yourself, and I think you missed something.
So yes, and I was kind of more telling you in terms of my specialty and how I got here. But yes, in terms of me, I have a lot of different I think like anyone, I'm a lot of different things, right? We're all daughter, sister, so many things. I'm also the president of the Ontario Medical Association.
Right.
Yes. I mean, it's so funny because you're right. There's so many roles that we hold at any one time. But yes, that is actually an all-encompassing role, especially right now. Which has been also being very rewarding because I'm also the first Black woman in this role. And I find that that's actually, it's a privilege, but also honestly, it's a big responsibility. And I always tell everybody, it comes for every time you're in the office and these little Black girls see me and they're like, oh my gosh, they're like, Mama, my doctor looks like me. I'm like, yes, I do. You can be here. You can take on anything that I've done is totally open to you. So I really do love the part of kind of the representation aspect as well.
Yeah, it's huge. Like I think about just, within the last, I think maybe last 2 weeks or so, Misty Copeland has just retired, right?
Yeah.
And I remember just for Black women and Black little girls and even just me, I'm I'm an adult, but I was just like, my God, I've never seen a Black ballerina, and she moved with such grace and poise. It just demanded your attention, and it just made, us Black folks to be able to see, we can see ourselves in other people in that way. And that's just so important that, you're the first should not be the last, mind you.
Absolutely.
But it's so important that, you have that role and that people can say, hey, she's there, maybe I could be there too, because people don't understand how important representation really truly is. Like, I think they see it as like a buzzword or a tagline, but it's
Yeah.
it's more than that. It's actually bringing that sense of belonging, right? It's feeling like I can
Hmm.
take up and be a part of that space where maybe
Yes.
traditionally I hadn't been seen in there. So I think it's so important that you're in that role, and that all the work that you're doing, of course, is now attached with that title as well. But it's important to be in that space. So I'm glad that you're taking up space, because I was like, she better
Yeah.
be like not downplaying this
No,
piece, right? And I was like, this is some important news. Like, I was like,
no, it's, you know what? It's one of those things too that it definitely takes up a lot of space. It also, I think that there's so many elements to it. Like even in the allergy world, like there's not that many Black allergists as well, right? So I think even in that space and in that kind of like teaching role, in terms of all the things that we do, representation plays such a big role in all of the different roles I hold. It's about when people from different places talk about the different foods that they have at home and we're trying to work through it.
right.
It's some of those things. It's, having someone that you feel that you could kind of understand and appreciate how important certain foods are to certain ethnicities.
Hmm?
And similarly, it's like having that, being able to look over and say, wow, you know what? That means that our voice is at those tables where you're talking about things. And so, definitely the role of the presidency is so key and so important. But I do appreciate what you said about taking up space, because I really do believe in that. I think about that every time I'm somewhere and I say, take up space, but also like for any other minority group, I say, me taking up space is also for you, right? Like, I want for everyone who's Black, I want everyone who's Indigenous, anyone who's a woman who's just say, you know what, we were in that space and we can be in that space because we also have that understanding. For any reason you've been othered, we have that understanding of coming in and taking up space. So I think that's also really important there as well.
Again, I'm just so excited that you're in that space, because I don't think people realize about when we're talking about allergies, like how foods and even bringing in that cultural piece, right? And understanding that, this maybe this thing that's an allergen is actually a part of like my diet. And it's like, how do I
Yeah.
navigate this? And some people just might not understand, because,
Hmm.
they just,
Yeah.
it's not their experience. It's not their lived experience, right?
It's not their lived experience. You don't understand how devastating removal of a certain food can be from one family to another.
Right.
If you remove peanut from some people, they're like, okay, changing it up. We have to look, but like, if I'm talking to like West African family, I know how much peanut is
It's like,
like
what are we
into
doing?
so much of our foods. And I know, and I'm saying, okay, listen, grandparents are not going to be as familiar with how strict we're talking about.
Right.
We don't see as much food allergies. Like I'm originally Nigerian, you don't see as much food allergies there, especially like growing up. So, trying to talk to that, because it's important for someone to like have seen you. Or,
Right.
I mean, a Middle Eastern family and their child is allergic to sesame. And I'm like, okay, guys,
Oh,
this is
no.
going to be a huge change for you. And they're looking at
Right.
me saying, oh, wow, you understand. I'm like, yes, I see how sesame and tahini is thrown around all over the food.
Right.
So
It's in the
it's
middle of the like where all the food is. Yeah.
exactly. And people don't think of it as something to worry about. Right.
Yeah, yeah.
So,
I think that I'm sure you take this into all of your teachings, because we'll talk a little bit about health equity and some of the work
mhm.
that you've done a little bit later. But yeah, it's so important for someone just to be like, to understand that perspective of like, this is not just a food. This is like a staple. This is a part of who we are. This is my cultural background. And to really bring that into the perspective of being, someone saying, okay, I truly understand, and this is going to work. Or even just to speak that same language, be like, yeah, I mean, I know we cook with all of that, but here's how to make
Yes.
sure that your child's safe. But let's bring it back to talking about some
Mhm.
of the work that you do, and so people can have a little bit of an
Yeah.
understanding and some education around some of the questions that I was like, okay, I don't know the answers to these, so I'm going to ask you. So, what would you say the most common misdiagnosis in children allergies there are, and how can parents and primary care practitioners avoid them, or can we not avoid them? Is it just going to be something that we're going to end up having to deal with?
You know, I think, It's like what you said earlier about how important it is to be able to say someone's name. It's the importance of being able to call things by their proper names. There's a lot of old vocabulary that still stays in place, and that causes people to be confused about what we're talking about. For example, people will say, my child has a cow's milk allergy. And so many people use that term and they might mean an issue that's just limited to the gut where the babies have some of the bloody stools. And that's a slightly different issue than if your baby has had dairy and had like hives, breathing problems, have a risk for anaphylaxis and need an EpiPen.
Right.
But people will use the same term.
That's
And
true.
then
Yeah.
understandably, these two babies are treated differently. And then those around you might think, oh, well, in one, it seems like they just automatically at around a year, they start to reintroduce dairy, which is the one with the gut, because you have to get the gut time to mature and then you try again. Versus the other one, you have to go through a slightly different process, make sure it is really safe, go through a baked goods, go through a very different process before you kind of go back. And so unfortunately, people then kind of say, oh, well, you said they have a milk allergy, but they're over one. I should just be able to give them dairy. And so some of the parts is that we're not using the right words. And I get it's
Yeah, they're
not
like,
an
what?
easy thing to say. Doesn't roll off the tongue as easily,
Right.
but it's important for us to differentiate because then people think, well, that one, then you just bring it back in. So isn't that the same with allergy? Or it's not as serious. That one condition doesn't require an EpiPen, but the other one definitely does. So there's some of that. And then there's things that we also some myths that are still in the world about food allergy. I think the most common one I think about is with egg allergy and the MMR vaccine.
Okay. Yeah. Yeah. You know
People are
why I'm
still
laughing.
talking about it. Exactly. People are still talking about this. And I say to people all the time, they're like, and I say, this is not an issue. Lots of studies have gone into it. People with egg allergies, even with anaphylaxis, can get the MMR in a routine fashion. I just always recommend you spend that 15 to 30 minutes after any vaccine still, because people want to get a vaccine and just get out. I'm like,
Right.
no, please just sit in general. And people say to me, is this like newer data? And I say, the studies from that is since like 1997. Like I was still very much like that was pre me going to university, you know what I mean? So, but it takes a long time for these shifts after
Right.
something's really entrenched. So it's hard to shift behavior. I think we both know that very much in healthcare. And unfortunately, healthcare does change over time, and that's a good thing.
Right.
I think about things that were done, 100 years ago. We don't want that done anymore.
Right.
But it's still hard to make changes. So pushing people to introduce foods early, people have such a fear now of certain foods. As an allergist, I know the later you delay, the higher the risk is, but people
Right.
are so scared. So, there's a bit of that back and forth.
Yeah. Well, here's a question for you in relation to that. So, for example, let's say my son has a peanut and tree nut allergy, and I have an 18-month-old at home. Is it safe for me to introduce nuts?
Yeah, so actually we recommend introducing it in the siblings because and we recommend introducing it without any prior testing because sometimes people say, can you test the sibling first?
Right.
There's great studies that show if you test them, there's a lot of false positive testing, and they actually challenged all these siblings, and most of them were able to tolerate it. If you have a child with peanut allergy and you have another child, same parents, everything the same, the risks of peanut allergy in the new baby is actually not as high as you think. General incidence of peanut allergy, 1% or so, 1% to 2%. And so I ask parents all the time, like, what do you think it is for your next child? And most people will tell me, I think it's 50%. I think
Right.
it's like 75%. We did the studies. We actually even looked at twins. We looked at like closest siblings, and it went up to 7%. So not super high.
Right. Wow. That's pretty surprising. Okay.
Yeah. So it's actually quite low. But what increases the risk is actually our behaviors. That's actually what increases the risks, right? Like delay because we're scared. You have had an experience. Maybe your first child did have, a scary reaction. I get that, being kind of worried. So delaying it, that increases the risks. If your child has eczema plus delaying it, that compounds it. Or introducing it once and not keeping it regularly, that also plays a role. So some of our behaviors can kind of increase that risk. So it is about talking about it early. Often if I diagnose one child, I'm already like, in case you have another kid, let's
Right.
just put this out there. I want you to introduce it early. I'm talking about that, 4 to 6 months, as soon as they're sitting up and interested in eating and can eat, let's start talking about introducing it.
Right.
But it's hard because you have maybe, a 3-year-old who doesn't fully understand the rules and wandering about. How am I going to keep peanut in this other baby's
Right.
diet? And I tell everyone, like, this is where, we have to get creative. I always say, okay, it's one person in daycare or school and one person's at home. Where are the grandparents? How's the dynamic of the family? Let's do some one-on-one times. And the one-on-one times with the baby is the peanut time.
Right.
And then we wash our face, clean our hands, because we know all the touching and everything. Babies don't really get that. But if you have to talk to people and say, okay, tell me about what it's like at home and how we can do this in a safe manner. Because if it's really difficult, we have to recognize that sometimes, we have to get creative, and you have to hear about each person's home life to make it work. Right? Because you do have to keep it regularly, optimally like once or twice a week. So let's talk about, when are the times you've got a couple of times per week where it's just you and the baby without the other child who has an allergy present, so that we can keep that going.
Yeah, no, I think that's important. Just again, like, mind blowing, because I'm just like, oh, I didn't know that, because my brother actually had a peanut allergy, and we thought this was like for life. He got tested when he was a kid and never tried peanuts, like, pretty much after that. And then he went and saw someone. I think my brother's like almost in his 50. He's almost 50, and they're like, you probably don't have that allergy anymore. And they tested, and he didn't. And he went on this, like, he did YouTube videos. He's like, I had a peanut allergy. I'm trying Reese's Pieces today. So he just went on this, and he just tried like every peanut thing underneath the sun. But that was probably something that I didn't know. My parents didn't know back then, that people can grow out of allergies. My brother grew out of his peanut allergy.
I know a lot of times people think that everything is like with allergies is lifelong, but our immune system has this great ability to change and adapt over time, and it can change its mind about things, right? So as much as you can grow out, you can also grow into it. So we know
Right.
adults who get surprised with like a shellfish allergy and they're like, what? Let's see what's happening. Let's see, because as much as I'm an allergist, I think I get the greatest joy when I delabel people and I remove their labels, whether it's a drug allergy or you've outgrown a food allergy. Like when people graduate from the clinic, I'm so happy. Like I'm like,
Yeah.
I've had a great time, but I do love when you get to graduate and you don't have to see me. Like
Right.
that's also so nice.
Yeah, it's such a
So,
win-win moment, right? It's just like, okay, look, this is you. It's like you graduated. You now don't have
right.
to worry about this particular thing. Yeah, no, I think that's pretty awesome, right?
And we celebrate, like we do food challenges to try to see if people are, have outgrown a food allergy. And even the sheet at the end, it says like, congratulations, you've outgrown your food allergy. And then it goes through all the things about keeping it in the diet, because
Right.
once you do outgrow it, you have to keep it. Your body needs to keep seeing it.
Mhm.
I tell everybody, it's like having a younger sibling. At first your body's like, I don't know. And then you see them all the time. You get over it. They're just part of the scenery. That's the important thing about keeping things in your life. I say that because I am the youngest sibling. So I was the one disturbing everyone until they just got used to the fact that I wasn't going anywhere.
Yeah. Oh no, I love it. I love it. I think that's a really good analogy for parents that are listening to kind of remember, right? That
hmm
this is like, if we've done the challenge and this is where you're at, you have to keep it up, right?
Keep it up.
Kind of moving on and pivoting in just a little bit here.
Mhm.
How do you approach a diagnosis for a child with multiple suspected allergies, whether they're food and or environmental?
I think when people see an allergist, everyone's very focused. They're like, I'm coming to you for testing. And I always tell
Right.
everyone, I'm like, oh, you know what? Testing is the tiniest part of my day. My biggest part is the history. I really want to go through because there's a lot of suspicions and then
Hmm.
we're really breaking it down. People say, wow, you ask a lot of questions. And they said, yeah, that's really the most part. I'm going through, okay, well, tell me about this. Tell me. And I'll ask you seemingly innocuous things like, have you ever had a score like milkshake or score this? And people will be like, yep, but my kid has never had nuts. I'm like, well,
They
score
have.
actually contains almonds.
Yeah,
So
they
that's
have.
great. So it's little things like that where people may not even realize. So you learn a lot about what's in different foods. And I go through all the history and I'm really trying to clarify. Because foods can affect you in a lot of different ways. Allergy is a tiny way that foods bother us, right?
Right.
And it's tiny, but it's pretty evident, can be kind of catastrophic, right? It can be very in your face, but foods can affect people in so many different ways. You could have celiac disease where definitely this, like having gluten can definitely affect you in terms of GI stuff, but can
Right.
also have implications for your thyroid later, gut issues. So very different. And I tell people, reflux also worsened by foods, not an allergy, not something I can test for, but I need to go through and clarify which ones sound more like allergy, which ones maybe more intolerance,
Mm.
which ones are more just like weird things about foods that they do. So, like some people have weird things with some of the mushrooms, and those are just an element of them. Populations. I don't know if you ever did this weird test in high school where everyone got this weird taste test, the strip, and about only one or two people in the class would have this terrible, visceral, this is an awful taste. Nobody else would taste it. And they're called super tasters. And they're the ones who think cilantro tastes evil and horrible. I'm in that group. I think
I'm in that
cilantro
group
tastes
too.
like, exactly. So if you ever did that, would
No
be like, oh,
cilantro.
I grew up, like I was in high school in Northern Ontario, and I remember my science teacher saying, one day you're going to try cilantro and you're not gonna like it. And I was like, what's cilantro? So, but it's one of those things where you will have, it's a chemical thing, right? Like, and you taste something very differently. And
Right.
so that plays a role. So foods can affect us in so many different ways. They can trigger migraines. They can cause
Wow.
so many other issues. But the part that I can do is very small. So I'm trying to go through all these different symptoms to figure out, okay, what is it? Which foods? Okay. And then with the environment, I'm also going through, I'm trying to figure out timing. I'm trying to figure out exposures. How old are you? Where have you been? Have you had exposure to certain animals? Or what do you do? Like, what's the environment like at home?
Right.
Do you guys have bees in the backyard? Are you on a farm? So many different things, right?
Right. Right. Wow.
So a
It's
lot
just
of it is history. I just sit there and I just like try to get to know you. And people
right.
are like, when are we getting to the testing? I'm like, half the time
This is
you
the
don't need
testing.
half the test. Exactly. The most important test is the history. And then I might do some confirmatory ones. And then, we go from there. And people often say to me, how do you know I don't have a milk allergy? For example, because people are often very concerned about milk. And I
Yes.
said, well, I asked you how you take your coffee. And if you drink a double double, then I know you don't. And they said, well, I have small bits of milk and that's okay. And I said, the ultimate test, the gold standard for food allergy is a food challenge where we give you
Right.
some of the food and we see how you respond.
Right.
You've been doing that on basically a daily basis. So that also helps with some of it. So I think people really focus on our skin prick testing, but as allergists, we really focus on the history and the kind of the challenges that have already been done naturally and really trying to sort that part out. So I
Yeah,
always tell people I'm
that's
more of a talking specialty than a testing one.
but that's important. And I think that maybe people don't understand that aspect. And I think that's quite revealing. I didn't I knew that history is important. And again, I think I was probably one of those parents that are like, just test him and find out what's wrong. And it's just like all of those questions. Now I'm like, okay, well, she was being annoying. But yeah, no, I can see how important all of those questions
Yeah.
are, and just kind of you're really like a sleuther, right? You're kind of
Yes.
investigating and finding all the various different pieces of evidence to put a picture together to be like, okay, well,
Yeah.
this is what might be the actual issue, right? Before you do the actual challenges. So I think that's
Or the
that's a
test.
perfect explanation. And now I need you to talk to my mother-in-law. It's so funny because she says this to me all the time. Amy, I can't have milk, I can't have dairy, I can't have cheese, I can't have any of these things. But she drinks like French vanilla ice stuff from Tim
Yeah.
Hortons like nobody's business. It's like her favorite drink. I'm like, really? You really think you have a dairy? How much dairy do you think is in that ice cap or that French vanilla you're drinking? But you can't have dairy. I'm just like, all right.
And that's the thing, right? We have to talk about intolerances, which, I talk about a lot. I was like, a lot of us are lactose intolerant and have
Right.
issues with certain forms of dairy, but certain forms we do better with. And that's okay to also know what you can and cannot eat, right? Like you should also be able to say, you know what, that just doesn't sit well with me. I don't eat this
Right.
because then I feel terrible. And that's okay. We all have those things. And I think the other part I wanted to mention for the testing and the assessment is people don't realize that testing has false positives. So we also don't want to use a test unless we have a good reason to.
Right.
Because if you have a false positive, it's hard. People then get really worried and they're like, well,
Right.
let's just do a challenge. Let's, and then people are like, no, the test said this. And you're like, no, the test can be, falsely positive, especially if we don't have a good history. So we don't like to even go down there unless we have a really good reason to. And people sometimes will just say, well, can you just test? And I said, let's talk about what the test means and how it works. You have to eat a food. Your body makes a decision. Sometimes the first or second time. Sometimes it could be a while.
Right.
So we have to also, once it shows up, then we do. Because I know it's frustrating. People say to me, why can't you pre-test? And then I will introduce. And I said, we could test things and it could be negative, but your body's never seen it.
Right.
But then when you do see it, it will make a decision. So it actually doesn't guarantee you anything. Your body needs to see something. It makes you make a decision. And yes, a lot of our food allergies present in childhood. But like I mentioned, the most common, allergies people develop in adulthood are things like the fish and shellfish, as well as some of this kind of fruit issues where you actually have like a tree pollen allergy and then you start to have issues with raw apples.
Wow.
So yeah, there's a lot of things that you could have had for a long time and then it presents. So, we can't necessarily preempt that. And we know there's false positives. Like, I remember meeting one of my patients and he was like, you should do a peanut test on me. And I said, why? You told me you eat peanuts. He said, well, somebody else did it and I have a 23 millimeter positive to peanut, but I eat peanut every day. And I said, yes, this is the reason we don't do tests without a reason.
Oh my goodness. But yeah, that's informative. And I think that the other piece is even the whole aspect of, adult allergies. I've heard the horror stories of, someone going out on vacation, they're an adult, and they're just like, they've been having shellfish for however long and they have a shellfish and anaphylaxis. It's just like, wow. How does that come into play?
Well, it's like I said, your immune system is constant in flux. It's always kind of changing over time. We think that it might be related to some of the people who are sensitized to things like dust mites, which is a very common allergen. And the dust mites, which are actually these little guys who live in our mattresses and pillows, they are not bed bugs. They're meant to be there. They're part of the circle of life. We lay in bed. We shed all our dead skin. They break this down. It's all a circle of life. Everybody's mattress has them.
Everyone's panicking now.
Brand new mattress, already have them. They're part of the circle of life. We need them. And a certain portion of people do develop allergies to them. Their shell is similar, has some similar proteins in it as some of the shellfish. So we think that that might be some of the role it plays in some of the later presentations. We wonder if it's that plus your predisposition, plus your genetics, and then it leads to that. So, but not everybody who has a shellfish allergy has a dust mite allergy, but we sometimes do see that. But definitely our bodies do change over time. I mean, you mentioned, you have children. I'm sure you've probably seen changes in your body post like pregnancy, because that's also a very interesting time for your immune system.
Yep.
Because your immune system has to actually learn, because anything that's like within your body that is not self, your immune system typically would attack. So actually your immune system has to change during pregnancy so that your baby is safe, because all parts of your immune system would be thinking, because it has DNA from somebody else, it would be like foreign, attack. So your immune system has to go through a lot of different changes there. And so people do talk about, my allergies were totally different during pregnancy. For some people, it actually gets better. Some people, it flares up. So those are some of the things that we have to realize, is that our immune system goes through all kinds of shifts over time. So yeah, we're evolving Always.
So how do we keep ourselves safe knowing that I mean, I guess the question is like just kind of dovetailing off of that, and then I have something kind of unrelated. But how do we, for example, as an adult, like what do we do knowing that, our bodies are constantly changing, that we might encounter an allergy? Like I don't think your recommendation is to walk around with an EpiPen. Like what are your thoughts there?
No, I mean, I would say the recommendation is keep a nice broad diet. Try to eat like
I
your
like
regular
eating,
foods.
so that's good.
Yeah, eat all the things. Be careful of like big fads where everyone says cut out dairy, because one of the ways is, we maintain tolerance. And so your
Right.
body needs to maintain that by seeing it. So sometimes we get worried when people are like, I cut out dairy for like 2 or 3 years, and then they reintroduce it, and then they had a reaction because their body was like, whoa,
What is
and
this?
had exactly. So,
Right.
that could happen. So we always say, moderation. You might want to, yeah, cutting down on some of because a lot of times we have dairy with a lot of refined sugars. It goes into a lot of, ice caps, a lot of different things with refined sugar. So I understand some people might want to reduce some of those, but keep a little bit of dairy in your diet still to maintain your tolerance to it. And I think just listen to yourself. I think what happens when we go into adulthood is that we're like, I'm fine. I'm fine. Did I feel off? Did I get a bit of hot? And we'll diminish our symptoms, right? Like if it happens to our kid, we would all have
Right.
everybody stop everything. But then someone will say to me, I used to get like a bit of hives every time I ate shrimp. But I was like, and then all of a sudden it got worse. So
Right.
we diminish our symptoms a lot more in adulthood. So I would say, start listening and looking, like if something is if you see this, then kind of investigate it, because sometimes we put it off a lot.
I think that's so important that we don't do a great job of listening to our bodies, but we really should, right? I think, like you said, because our bodies are constantly changing, it's important that if we've eaten something, or we have that day where something might be off, that's like maybe it is something we've eaten. And just to kind of pay attention, like maybe the next time I try this, do I still have that headache or whatever the case may be? Because I think that's important that we notify those things. And then the next step would be to like contact your primary care provider, I guess.
Exactly. And then talk to them, because, yeah, it could be something similar as I've seen them for a primary, like other issue, but they mentioned to me, they said, it's terrible. I can't have chocolate anymore because I started noticing, she always thought that whenever she had a stressful period, it was always the stress that which also plays a role in her migraines. But she said, I also often would have chocolate, like as my, after. And she was like, the next morning I would always have these like migraines. And then later she started noticing just in general, whenever she had chocolate, and chocolate is a trigger because it contains certain neurochemicals, right? And so it's one of those things where, she took a while, but she's like, I finally realized it's terrible. And it's terrible because I really love chocolate, but I did notice it played a role in my migraines.
Yeah, I'm so sad for
And
her.
find other things. I'm like, is chips, like find something else. But yeah, but sometimes it's making those kind of connections. And
Yeah.
it's not always allergy, but it's always just for you to figure out, like, my body, like rules. Listen to your body's rules. And that's okay.
That should be on a shirt. Listen to your body's rules, right? No, I like that. And just kind of backing it up a little bit. One of the things I saw recently, and you probably follow this allergist, and now all of a sudden the name escapes me. He wears a bow tie.
Yeah, Ruben.
Yeah,
Yes.
Ruben. So
Yes.
I saw him talking about Benadryl, and I was just like,
Yeah.
what is going on? Because one of the things is, it's important for us to talk about current guidelines and best practices. And I would say that the general public probably doesn't know this, because Benadryl was still on my child's anaphylaxis care plan at school. But again, I'm seeing that evidence is saying something else. Do you mind sharing your insights on a Benadryl?
Absolutely. Anytime I give a talk, everyone's like, she's also going to give you the Benadryl rant. And I would say that it surprises many people. Most allergists across Canada do not like the use of Benadryl. We actually have a position statement from our Canadian Society of Allergy and Clinical Immunology about the use of it, and asking for people to stop using Benadryl and some of the older ones, use newer second generation ones, because the older ones cross blood-brain barrier, they do affect your brain. So they can be similar effects as in terms of alcohol, in terms of driving tests. They've shown that. Also, if you're giving Benadryl routinely to a child, like regularly, people sometimes do that in the allergy season. Unfortunately, it affects the brain, and they don't learn as well as their peers, because it's very much it is affecting the actual function of your brain. So we don't recommend it. If you're in some parts of Europe, you will see the name brand Benadryl, but if you actually read the drug in it, it's not the same drug that we have in Canada. They actually,
Really?
they use
Wow.
the brand name, but they use a different medication in it because the actual drug that is in Benadryl in North America, in some countries in Europe, it's only sold as a sleep aid. So I always say to parents, would you give your child a sleeping pill? And everyone is
No.
horrified. And I said, exactly. So let's not give them Benadryl. There's this thought that it works faster. It doesn't actually, but the sedation aspect of it does come in pretty quick. And so it's not that you're not having an allergy, but you just may not be feeling it the same way. And I
That's
don't
so
want
wild.
that. That's the last time I want you to be less responsive. I need you to be fully
Right.
responsive. I need you to tell me what's happening. I don't want people to think, oh, they're just sleeping. Well, what if their blood pressure is actually low and they're putting their head down because they
Right.
have hypotension? I
Jeez.
don't want any confusion. So I tell people, no Benadryl. I generally, for food allergy, I'm often saying, let's talk about what the symptoms are because I want us to be clear on what anaphylaxis is and recognizing anaphylaxis and using our EpiPens. Environmental allergies, definitely lots of antihistamine use, second generation, non-sedating, preserve your brains. Also, a lot of Benadryl use over life, increased risk of dementia. And we already know there's so many other factors that increase our risk for dementia. We don't want further ones.
Wow.
So we tried as the Canadian allergist to try to ask to get Benadryl, even just put behind the counter. So it involved a conversation. It's hard to address medications that are over the counter is what we've encountered. So it's really trying to explain to people about the second generation ones, what the differences are. It is not better. It is not faster. We have great antihistamines now. Benadryl is not studied in children. People say, oh, well, it's been studied in children. I said, actually, it's super old that at that point, from the age of when it came, you didn't have to do as extensive studies. If it went through the studies that are required today, it actually wouldn't meet the criteria because you have to be shown to not affect so many different things now. So we have so many more options. So talk to whoever's in charge of your health or your child's health about what the options are. But there are so many more options that are safe and effective and work quickly.
Yeah, well, I saw that TikTok and I was just like thankful that I did because nobody talked to me about it. Again, like I just hadn't seen my child's pediatric allergist for so long. And it just kind of came as like this like bullet. I was like, oh my goodness. Like he hasn't had any for a while, but like we have it on his asthma action plan. It's like, okay, he gets his EpiPen and then we're gonna give Benadryl, and then we're gonna give Benadryl. I'm just like, oh my god! So it's like, call the school, like take that off. We're just working with the EpiPens right now. But as a parent who's in healthcare, I didn't know, and it was TikTok that brought that to my attention. And this is why I tell other folks, I'm like, social media is really powerful because it reached me as someone who I'm a nurse, I'm in healthcare, but I didn't know that. And I could only imagine how many other parents and folks out there that don't know that. I kind of think to myself too, I wonder like how many hospital policies do we have, order sets and various different things? Have they been changed? I mean,
for definitely like especially the children's hospitals, and like I proximally in Mississauga, so talking with like Trillium to ensure that they have the other antihistamines there.
Right.
The one thing I tell people is that, listen, if you're giving something IV for whatever reason, we only have the one IV formulation in Canada. We only have Benadryl as IV.
Right.
In the States, they have IV cetirizine, but we don't have that, unfortunately. But I said, usually though, when you're using it, it's not necessarily that it's an acute allergic response. It might be like as part of like you're getting rashes from like morphine or something,
or whatever. Yeah.
And you have to use something IV, understandable. But if you're using something and you're going to use it orally, then you should be really using any of the second generation antihistamines.
I see. But still some work to do on some of those order sets and standing
Absolutely.
orders. Yeah. Like, so one of you did kind of mention, and again, I know we're going to wrap up. I have one health equity question that I wanted to ask you. But so, for example, you said that we can't change it. Is this like a federal government type of move? Is this something like, because we don't have FDA here. So for such a change like that, and you're saying that there's some difficulty, who do we need to speak to? Is it the federal government? Is it something?
It'd be federal and through kind of Health Canada. That's why we were kind of trying to do it through the society, and we put out the paper and trying to raise awareness to try to kind of move that, even if it's just behind the counter, which requires a conversation.
Yeah. We're raising awareness now. We're
Totally. I mean, and we've been trying to do this. I mean, I think, a lot of us, and it's great because we need more, we talk about this, we need allergists in different spaces, like on places like TikTok, Instagram, everything, Benadryl is one of the things, but there's so many other misinformation aspects to it. And that's why we're trying to raise awareness. And so, I think we've all done lots of news articles on this in the past as well. And the other thing that I think is important, which people don't talk as much about, is that antihistamines, like any medication, can also be dangerous in high doses.
Right.
And you can actually kill people with Benadryl, which is not the case for a lot of the other second generation antihistamines at very high doses. So now when you are trying to get, qualified to be used, for example, I think some of the newest antihistamines on the market are like rupatadine and belastine. And when they have to do their studies, they have to show that if you took 10 times the dose, that it wouldn't affect cardiac arrhythmia. They make sure of that.
Right.
We would never let anyone take 10 times the dose of Benadryl. Because remember, for an adult, it's 50 milligrams. That could actually end up being a lethal dose. And we've seen people, if you look at all the evidence in terms of people who have died from antihistamines, it's typically, unfortunately, diphenhydramine or Benadryl. So that is the one. I mean, we've had, unfortunately, kids with misdosing under care. We've seen those cases, which are devastating. We've seen murder cases with it as well, unfortunately, because it can be dangerous. So it's a big issue, and we're continuing to try to bring it up whenever we can, and we try to raise awareness. I remember one of the Emerge docs was like, yeah, one of your patients came in and, someone said to them, oh, did you try Benadryl? And they were like, my allergist has told me all about Benadryl. And I was so excited, because I think it's two ways, right? Like I said, it can take time for changes to perpetuate the system. So I feel like I love when my patients are empowered to also let other healthcare providers know about it. Right. I share with other healthcare providers, with patients, with really anyone who will hear about me talk about Benadryl. I'm happy to.
Yeah, knowledge is power. The conversation's been so engaging, but we only have a little bit of time, and I don't want to keep you. I know it's we'll see how we could do here. But I really want to ask this health equity question because you've done so much pivotal work in this area that I think it's important to talk about health equity as well as, allergy and clinical immunology. So just quickly, in your experience, are there particular health equity issues that disproportionately affect the diagnosis or treatment of childhood allergies in certain populations? I know it's so long, sorry.
But you know what? There are a lot of issues in terms of equity when we're talking about allergy immunology and just in certain populations. For example, everyone gets very focused on food allergy, asthma, environmental, but I always remind people when we talk about atopy, which is kind of that predisposition to developing any kind of allergic-like disorder, it often starts with things like eczema, right? So atopic dermatitis or eczema. And the fact that, now we're pushing more to teach our medical students and residents to see skin of color because you need to be able to recognize it across different shades. Eczema looks different, we are different shades. Yep. Eczema looks slightly differently on both our skins, let alone all the textbooks are showing redness and I don't show redness, that same one.
Might not show up.
It might not show up like that. You have to recognize that it might look a little bit more violaceous. So it's a little bit more purple. And I tell all my learners, I say, hey, listen, what if we mixed a little bit of red with a little bit of like brown or pigment? You're going to actually get a little bit of purple, right? Like I was like, I always say, like, have you ever mixed lipsticks? Like that's how you, so you're going to see a little bit more purpley on my skin. You're going to see, we also have there's different types of eczema. So you have to know that being someone who's Black, I might have a little bit more of some of the circular ones. I might have some of the ones that looks like little dots as well. So you need to know about that.
Right.
So because if you're missing these, because then these are some of the children who are high risk that we say introduce foods early, introduce the high risk ones. If you're missing that they have the risk factor, how are you going to intervene? How are you going to have these targeted conversations? How are you also going to treat that? Because sometimes I get people as being sent, they're like, there's this crazy rash. I don't know what it is. And I look at them like, oh, this is a good old fashioned eczema, just in a different skin tone. So you have to be, I think, ready to learn about that. You also have to know what even hives looks like in different skin tones. Also, not going to be the classic, they talk about it turning white on the skin. Well, it's not going to turn white on my skin.
Right.
But it will be lighter than my skin once they're like big welts. But you have to also know that. So that's why I think that health equity is so important for us to think about. And you have to think about it too when you say something like you do have a food allergy, and if if the family's already struggling, we have to really have these real conversations about it. And you have to recognize that everyone's diet is different, and you should ask people, is this something that is really going to change the way your family works? Your family, not just like this child's diet, but like your family, you're just like, oh, make a separate meal for the child. Listen, if people are under constraints, grocery prices are insane already. Are we really thinking about that? So the experience can vary quite a lot. And people need to also you have to recognize that some of the things that we're looking for in food allergy are also like a change in behavior is one of the symptoms, which people don't think about.
Wow.
When I'm doing a food challenge, and I remember one of my patients, he's so rambunctious, he's like everywhere. And all of a sudden I was like, I go back and forth and I always peek at him and, at one point I was coming and I was like, it's really quiet. I'm not hearing anything from him. And he was sitting next to his mom and I was like, okay, guys, bring him in. It was like, I know mom's like, yeah, it's weird. He's kind of quiet. I'm like, nope. And literally, and like the mom was like, oh my gosh, because then we were treating him EpiPens, everything, because it's like even recognizing those.
Wow.
So someone might just be like, oh, this person's always rambunctious. It's good that they're quiet or something. You don't want that either. So I think that it's so important to just have that different view and to recognize that it is important for people to learn about different cultures, about where people are coming from, and how important certain foods are to certain cultures. And you have to recognize when you're really asking people to make a huge shift in their life. And if you don't give them the space to talk about it, they just kind of leave so bewildered and they just don't know how to proceed. So we do owe them that. And you have to, because you can't think of just the North American diet. I actually don't exactly know what constitutes the North American diet per se, but
I don't either.
I'm like, it's a mix of culture. So I always say how is this food for you? Like, does this play a role? Like, how big of a role is this for you? Is this like a pivotal food for you or not? Because for some people it is, for some people it isn't. So I want to know how much of an impact so that you can support people as best as you can. So definitely certain populations, especially equity deserving populations, are often kind of people forget to ask some of these extra questions or recognize certain things. And so we need to have more of that. And, and that's the part about representation, because people will say to me, okay, do you know about this? Or they'll say, do you know about fufu? Do you know about this? And I said, okay, yes, go on, tell me, tell me, which, I think of, where I practice, I see a lot of families who make different kinds of dal, and I'll say, okay, which dal was it? And they're like, wait, that there's different kinds of dal? I'm like, yes, I know that there's about different kinds of beans and lentils, and I need you to break it down. I know which one we're talking about here. So I think sometimes just opening it up and saying, okay, tell me more about that is really huge. And I think we need to give more space.
Yeah.
We need medicine to also allow for more time to spend too. And that's tough because there's not that many allergists. There's so much pressure on us, but we want to be able to give you that time to go through it. So I think it does play a huge role for equity. And I hope that people know out there that, ask for the space and time too. Like, don't be afraid to say, what, this has had a huge bearing on me. What are the options? What can I do? And ask the questions that really matter, because when we're talking about things like foods, this is different from you have a blood pressure issue, you're taking certain medications. This is different. This is affecting everybody in the household, not just the patient.
Yeah, no, I'm so glad that you said that it's important for patients even to come forward to ask for that time to say and to know that it's something that we can do. Because I think sometimes there's that hesitation. It's like, oh, this person, I know they're really busy, so I can't. But it's just, knowing that we have that space that we can ask, and that it's important that we do ask.
Yeah.
And like you mentioned, that whole cultural aspect and knowing the differences. Like, I know there's another influencer. He's American. I believe his name is Dr. Joel, I'm going to botch his name because I can't remember.
Maybe.
Yes. Yeah. That he's doing some of this work where he's really showing the differences between skin colors of various different issues. And I think it's so important that we have that. Like, I remember looking at my textbooks, and I rarely, if ever, even the mannequins that we worked on were not racialized. So it's so important that we're really, shifting the zeitgeist, because we need to. Because again, we need to see better outcomes for not just some people, but for all people.
All people.
And with that, Zainab, we have to have you back. Like, I have so many more questions, and I know the time we have to respect time, but it was such an amazing episode, and so I'm so grateful that you came on to share your knowledge. You are a wealth of knowledge, and thank you so much for taking up space and sharing your time with me and sharing your time with my guests. So I think there's more. I'm sure people will be like,
we'll do another one. We need to say we're going to do one. We're just going to talk about health equity, and we're going to talk about and just delve into
four
that.
Questions. I'm like, I'm not going to get to them today, but yes, I would love for you to
health
come back
equity.
And
Let's talk about it.
Equity one
across all realms, beyond allergy, just in medicine. We're going to talk about it from nursing perspective, from physician perspective, from our learners, and how they're coming through the space and how we're protecting them, knowing how much is coming towards them too, and how we teach them to be able to actually also be good advocates for those, to allow for equity to continue, and how it's a continuous journey.
People are so afraid to say that there's racism in healthcare, but there is.
There is. There is. And we're going to speak on it on our next one.
Yes, we will have you back. Thank you so much for coming on the Green Nurse Podcast. All the best for the rest of your day today.
Thank you.
Yeah, I'm just so grateful. So thank you so much.
Thank you. I'll see you soon, I'm sure.
Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amy Archibald-Burley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.